Dr. Augustine Kwabena Tawiah is an obstetrician and gynecologist in Kumasi, Ghana. He shares some insight on endometriosis.
Endometriosis is a condition that simply means the presence of endometrial tissue outside the endometrial cavity. Now, if you take the womb or the uterus of a woman, it has three layers. We have the outside layer, what you call perimetrium. We have the middle layer, which we call myometrium, and we have the inner layer, which we call endometrium. So endometrium is supposed to be inside the inner layer of the uterus. So once you have tissues of the endometrium outside the endometrial cavity, that's what results in endometriosis. So in simple terms, endometriosis is the presence of endometrial tissue outside the endometrial cavity. Endometriosis has been known for years. However, there's not a single cause of endometriosis, but certain factors have been associated with endometriosis that led to the development and the progression of the disease. Some of the factors include a genetic factor, means that it's known to run through families, a first-degree relative, a mother, a daughter, and a sister is known to run through. And then environmental factors, it's known that air pollution, pollution of water, and it can also occur because of a complication from surgery. Now, endometriosis essentially presents with heavy menses, heavy menstruation. It presents with pain. It can also present with infertility. So in terms of reproductive health, it's a huge burden. There are treatments, but the treatment is tailored to the wish of the patient. The treatment may be medical, maybe surgical, maybe a combination of the two. So, for example, all that we do is to stop the production of the human estrogen. I advise all patients, all women, to seek care. They should not ascribe lower abdominal pain, heavy menses, inability to conceive, to other conditions. And to they present to the hospital early, we take a detailed history, we perform a thorough physical examination and investigations such as diagnostic laparoscopy. We come to at least make a diagnosis of endometriosis. And once endometriosis is diagnosed, together with the patient, we counsel the patient, and then the appropriate treatment modality is offered to the patient.